Hello, I'm Dr. Brandon Menke, one of the comprehensive ophthalmologists and partners at Illumin, and I'll be talking to you about cataract surgery. Cataracts are a very common ocular manifestation of simple aging. What happens is that when we're born, we're born with what you can think of as clear, squishy, bouncy balls for lenses. And then as we age, they become more yellow and more hard with the progression of a cataract. That would be the manifestations or symptoms of these cataracts would be glare, halos, difficulty with contrast, color, and most commonly, difficulty with night vision and headlights when driving with oncoming lights. The hardening of the lens is what then in our early 40s we can attribute to something called presbyopia, or when typically people need reading glasses. And then as we age, we typically become more nearsighted, or why every year or so you may notice that your glasses prescription continues to need changing or updating. Eventually, cataracts make it where glasses can't get you any better, and that's typically when we start talking about cataract surgery. Cataract surgery is fairly standardized anymore, and one of the most common surgeries done in the United States, certainly one of the most common surgeries that I do. If, again, you think of your lens like a clear bouncy ball or an M&M, what I do during surgery is I go in and I suck out the chocolate of the M&M, leaving that clear shell, and then put a new lens inside its place. That's where we can talk about some of the customization that can happen in ophthalmologic surgery or during cataract surgery, where we can put in several different types of lenses to meet your needs. There's three main types of lenses. One would be a standard lens that we aim for good distance vision typically, but doesn't correct any astigmatism, and you would need glasses up for reading up close. Typically, that is to clear up the vision, but not necessarily make your glasses independent. Another option is a toric lens that corrects astigmatism, but again, would not get you out of reading glasses. And the last type of lens would be a multifocal lens, of which there are many types, that potentially gets you out of glasses at distance and near for reading. Thank you for listening to this short presentation on cataracts, what they are, the cataract surgery, and some of the customizable lens options that we have. If you have any questions, certainly feel free to call the office or schedule an appointment to speak with me at any time.